Hi, good morning and welcome to my YouTube channel. In today's video, I'm going to be showing you how to use the Find Test strip to do a rapid diagnostic test for your fasting blood sugar or your random blood sugar. So it's World Diabetes Day and I'll be talking a bit about diabetes, but first I'm going to be checking my blood sugar this morning and I'm going to be showing you how to use these kits. So first I'm going to open it and bring out this. Of course, this is the manual in here. And this is my methylated spirit. And this is my cotton wool. I'm going to be showing you how to use the easiest things. So you can either use cotton wool and methylated spirit, or you can use your alcohol swab. And this is the machine itself. So you open it, and this is what we have in here. Here is the pen, which I'm not going to be using because I'm carrying out the test myself and it will hurt me so bad. So I'm just going to be pricking myself directly instead of using pen. This is the machine itself. I'm going to be opening it now to put my batteries in here. As you can see, I'm placing my batteries. And after placing my batteries, it will come on and go off. And this is my pack of Find Test strips. So I'm just going to be opening it and picking out one. This is how it looks. Of course, you're seeing this arrow. So this is the arrow you're going to affix to your machine. And you hear a click sound. You heard that, right? And it will show something like this and tie it to 0. Here we have my pack of lancets. So this is my lancet and I'm going to be opening it up now. First, I'm going to use the alcohol, the spirit, to clean my thumb. So here is the jerk. You use your spirit. I'm teaching you this for the sake of your patient or even for yourself. This is my left hand, this is my right hand. So I'm going to use this spirit and massage my thumb. Why I'm massaging my thumb is so that blood can flow, right? So that's it. Aside from cleaning, I've massaged my thumb. And this is my lancet. So I'm just going to go in with a quick prick. As you can see, blood is coming out. As you can see, there's blood out. So I'm just going to bring in my machine and let it touch. So this is my result, 84 milligrams per dl. And this is how to calculate the reading. This is a bottle of the Find Test strips. Of course, you can see you already checked the expiry date and all that. And then when you pass that side, you will see the control range. And for low, between 30 to 60. Here it's calibrated both milligrams per dl and millimole per liter. And that is for the normal, 76 to 102. And the high is 216 to 290, as you can see here. So that's it. And then it's also calibrated in millimole per liter. That is 1.7 to 3.3, 4.2 to 5.6, and 12.0 to 16.2. So that's how you get to know the reading, what is what, from the strip itself like this. So As you keep staying tuned, I'll be talking about diabetes now.
Diabetes, also called diabetes mellitus, is a group of endocrine diseases that appears as hyperglycemia, that is high blood sugar levels. It is caused when either the pancreas is not producing enough insulin, or the cells of the body becomes unresponsive to the insulin's effects. And the classical symptoms of diabetes are polyuria, polydipsia, and weight loss, where polyuria means frequent urination or larger volumes of urine, and polydipsia is increased thirst, the craving for water, and there's a significant weight loss as well. There are several other symptoms that could worsen if left untreated, and it could lead to a lot of complications of the heart, of the eye, of the kidney, of the nerves. And the statistics shows that diabetes is responsible for over 1.5 million deaths every year. So you can see that diabetes is a very serious condition, and that is why on today's occasion of World Diabetes Day, I've decided to create awareness. The types of diabetes range from type 1 diabetes, type 2 diabetes, gestational diabetes, and there are other factors that can lead to diabetes, like family history. For type 1 diabetes, family history is most likely implicated. That if a person has a history of type 1 diabetes in their family, he or she is more likely to come down with it. And for type 2 diabetes, that could be as a result of obesity, lack of exercise, genetics, and several other factors. And the way to diagnose diabetes ranges from blood sugar tests to urine tests, and the common blood sugar tests are the Rapid Diagnostic Test, which I've just showed you how to do, and it could be fasting blood sugar or random blood sugar, that is checking your blood glucose in the period where you're starving, you've not eaten, and in the period as after you have eaten. And there are a lot of things surrounding diabetes, but one thing I would like you to know majorly is the fact that lifestyle changes are a way to help reduce the intensity of diabetes, and it could even help reverse diabetes in the long run. And proper diet too is very essential. The medications for the treatment of diabetes range from insulin to anti-hyperglycemics, that's medications, a wide range of drugs, a wide range of classes, which I'll not go into details in this video. I'm going to basically be talking about the lifestyle modifications in the treatment of diabetes. And I will start by letting us know that we need to pay attention to lifestyle practices like smoking, because it puts us at risk of diabetes, to high blood pressure. So if you're hypertensive already, you will want to control your blood pressure properly so that you do not come down with diabetes, because sometimes it comes as a complication of poorly managed hypertension. You need to exercise regularly and keep a healthy lifestyle. If you're diabetic, you would need specialized footwear to prevent your risk of having diabetic foot ulcers, and you would want to be careful with your body and your skin so that you do not come down with injuries. It's important too that you take your medications and you monitor rapidly and frequently. That's why it's advised that you should get a glucometer, that's a blood glucose monitor, just like I've showed you. Fine test here. And from time to time there should be sensational testing. You should test to know if your receptors are still very great, and it's important that you know that these are your symptoms or your triggers so that you can better manage the condition. Exercise, like I've just highlighted, is one of the ways, as well as weight loss programs. Also, you would want to do dietary modifications, consult your dietitian, and any diet that is capable of achieving weight loss is capable of also managing type 2 diabetes. And it's important too that you know that the medications for diabetes are very, very essential, and you should take them as prescribed. Consult your healthcare providers, your physician, your pharmacist to help you with management. And if you are concerned about diabetes, just know that it's not a death sentence. Know that it's not a curse. There are a lot of people living healthy lives with diabetes, and you could also be one of those people. You could also be one of those people. So that's just a brief summary about diabetes for you, and I'll be open to your questions. Thank you for watching my video. Do well to like, share, subscribe, turn on your notification bells, and see you in my next video. Happy World Diabetes Day. Reach out to someone that you know living with diabetes and encourage them, because their lives are precious.